In this video today, we're going to talk about disc herniations, what that means, and how it could potentially be a problem, and what are your different treatment options potentially for them. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist. I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients understand what are your options, what that means, and how you can be able to punch pain in the face and get back to leading the life that you deserve. Today, we're going to talk about disc herniations. And as you could probably guess, not every disc herniation is the same. So disc herniations, the disc itself is comprised of two primary parts. One is something that's called the annulus fibrosus, and the second is something that's called the nucleus pulposus. So the annulus fibrosus are the rings that start from the outside and go in. And the center component is called the nucleus pulposus. When you take a look at the difference between disc bulges, the major difference is it contained or is there a rupture? A contained disc bulge means that there is no leakage of the nucleus pulposus outside of the annulus, versus the aspect of ruptured, which is a push through that aspect of the annulus and then results in terms of leakage into various different spaces. There are three different types of protrusions or herniated disc. The first is something that's called a protrusion. The second is something that's called an extrusion. And the third is something that's called a sequestration. So a protrusion means that you have pushing of that nucleus pulposus into various different layers of the annulus, but it hasn't necessarily penetrated the outermost layer. An extrusion is just that, meaning it's actually gone through the outermost layer of the annulus. And a sequestration means that a piece of that nucleus has popped off and is now separate from the context of the disc. So when we look at these things, we also need to be able to give semblance of where that is anatomically. What I mean by that is the following: is not every bulge bulges straight back into the center. Sometimes it bulges to the side, and sometimes it bulges to the far side. So if we're using the fancy terminology for this, there's something that's called a central bulge, which means that it bulges straight back towards the area of the spinal cord. There's another type of bulge that bulges in between the spinal cord and the exiting nerve root that is called a posterior lateral bulge. And then finally, there's one that bulges into the area that's called the foramen or extraforaminal disc bulge. All of these predispose themselves or suggest that they can be treated in different ways. Whether you treat a contained bulge in a certain fashion, whether you can treat a ruptured bulge in a certain fashion, if it's posterior lateral or if it's foraminal, there are certain techniques that can be utilized in lieu of traditional surgery. And the fact of the matter is, when most people think about a disc bulge, they kind of clump it all together with the assumption that it's causing sciatica, and frequently it acts in concert or in conjunction with other problems that are going on in the spine, whether it's cervical, thoracic, or lumbar, to cause the sensation that you feel, which is traditionally a compression of the nerve root. If you found this video of value, please hit the like button. If you have questions or comments about having a disc bulge and how you were able to treat it or improve it, please leave them in the comments below. Thank you so much.